You all set to go?
Yeah, see, I don't know if they're required, but I have yeah.
All set to go? Everybody ready? The work session of the Annapolis City Council will be called to order at 3 p.m. on Thursday, February the 20th, 2020. At this time, would everyone willing and able please stand for the Pledge of Allegiance. Mr. City Attorney, please present the first item on the agenda.
Yes, sir, Mr. Mayor. The first item on the agenda is a presentation from Anne Arundel County Chief Health Officer, Dr. Nash Kalyanaraman. Hopefully I pronounced that correctly.
Good job at that. How you doing, Dr. K?
Good to see you, Dr. K. Good afternoon. I invited Dr. K here because I believe his first month was September. We met in October. I was extraordinarily impressed. We've been in probably at least 10 meetings since then. And I continue to be impressed. And I thought since the city does not have a health department nor a school system, I thought this was a perfect opportunity for Dr. Nash to come in and give us an overview of the state of the health department and how we all can work together. So, Dr. Nash, thank you so much.
Even better. There we go. So as Alderman mentioned, I started in September, almost 6 months ago, and I had the opportunity to meet with the mayor as well a few months ago. I haven't had a chance to meet all of you yet. But I wanted to talk a little bit about what the department is doing, what the direction is, and also about how we can work together to address the health needs of Annapolis City. I'll give you a little background. The health department is it has 800 staff. We serve the county of Anne Arundel and also the city of Annapolis. We provide a range of services and connections to care. Our goal is not to provide direct healthcare services. It's to provide preventive services, education, connect to care, and in certain limited instances, we do provide direct services, usually where there are gaps in the community care that are not being met. We provide environmental health services, so that's restaurant inspections, multi-dwelling housing inspections, well water, and the swimming pools. We provide preventive services through immunizations, sexually transmitted infection screenings, HIV screenings, pre-exposure prophylaxis connection. We provide behavioral health services. So those are some of the limited direct services we provide, which is substance use disorder treatment with medications. So with methadone and some limited Suboxone, and adolescent and family psychiatric services. We provide those services specifically because that is not being provided in the community. There are reimbursement mechanisms for those, but they're just not being provided. We would be happy to not be in that business, to be quite honest. We also have our Wellmobile, which many of you know about. It is in Glen Burnie. It is there for 2 days a week. It is grant funded, and it provides same-day connection to Suboxone services and then connects people to care typically within 1 to 2 weeks and sometimes as long as 4 weeks. We are currently in plans to expand to Annapolis City. We have grant funding. We have a grant request out with the OOCC. If you've met me, you know I'm terrible with acronyms, but with the OOCC, and we're waiting to hear back from them, honestly, any day now. We were told this week we'd hear. So providing those services in Annapolis is a key priority for us. We obviously provide school health services in all the public schools in Anne Arundel County, including in the city. And we provide family health services, including WIC, Healthy Start, Strengthening Families, and all of the programs that I mentioned are located throughout the county and throughout the city. In the city specifically, we have our Parole Health Center, and we'll talk a little bit about that. And we are constantly looking to how we can better meet the needs of folks. And so to that end, I wanted to talk a little bit about where we're headed as a health department, and what that looks like and what that means, not just for the county, but for the city specifically. I want to focus on three main areas: the Healthy Anne Arundel Coalition, what we're doing around gun violence, and then health equity. So the Healthy Anne Arundel Coalition is our county, and every county in Maryland has a local health improvement coalition, which is meant to identify the health priorities of the community and collectively address them. The Healthy Anne Arundel Coalition was operational between 2012 and 2017. In 2017, that was the last time we had a permanent health officer. When that person left, the leadership for that group faded, and there have been some meetings, but really it hasn't been operational since then. One of my priorities coming in, and I'd actually talked with the county executive about this in June when I first met him, was to restart this, because the core of public health is identifying the needs of the community and then working with them to implement solutions for those. That's easy to say, it's hard to do. It's hard to do because it takes a lot of effort, and it also means ceding power and control, which is what agencies and organizations are not as good at. And I can assure you that I will struggle with that too, but we have to engage in that work. And so to that end, we relaunched this a couple of weeks ago. The Alderwoman Pindell Charles was there as a representative of Annapolis City. We have a few elected officials, actually just one other. Councilwoman Fiedler is the other one. The membership of that guiding coalition is composed of some county agencies, some city agencies, hospitals, federally qualified health centers, economic development, community action agency, and is really meant to provide that commitment to investing in the needs of the community. And when I say community, I mean that very broadly, but we also need representation from throughout the county, and that includes Annapolis City. And so as we are going on March 27th, our next meeting is a community meeting, and we'll be putting out information. Through our guiding coalition members, mentioned the Alderwoman, and through other agencies to get community participation in that meeting to identify the health needs for the communities in the county. You will be seeing and hearing more about that. We will be sharing more information about what comes from those community meetings, what our priorities are, and how we move forward on that work. The second thing I want to talk about is gun violence. I know that I believe Monday there was a community meeting on that in the city. This is obviously a critical issue in the city and in the county. It's a very polarized issue. For what we're trying to accomplish, gun violence is a public health issue. And what we mean by that is that it's focused not on guns, but on lives. How are we saving lives? How are we preventing injuries? And when we put that as the focus of the work that we are doing, the range of solutions changes. It changes what we are talking about. And of course, we'll talk a little bit about guns, but we talk much more about what are the causes of violence, both in terms of suicide and in terms of homicide. The gun violence that we see is about 67% or so about 2/3 is actually suicides. The rest of it is homicides. Mass murders are a fraction of what happens. We had a very high visibility mass murder in this county a couple of years ago, but that is generally the exception in jurisdictions, not the rule. And so in order for us to really make headway on decreasing gun violence, we have to look at from a very database perspective of what is actually happening. How do we actually get a handle on what it is that is the problem? And so to that end, When I say that this is a public health issue, what I mean is that there's a very specific way for how we address this issue, how we think about it, and how we put into place programs to address this. It means, one, we have data, that we actually talk about it from an informed perspective and not just from an emotional perspective. Stories are important, but they're only half of what we need to look at. We also need to understand, what are the risk factors? What are the risk factors for suicide? What are the risk factors for homicide? What are the risk factors for gun injuries? What are the things that prevent those from happening? What keeps people from committing suicide? What brings violence down, interpersonal violence down? And then looking at how we can use evidence-based practices to address each of those risk factors and or to improve those protective factors. And that means using strategies that have shown that they work, and working with our research institutions to look at strategies that we think may work, and collecting data and understanding whether they do or not. We are currently working to develop a relationship with the Johns Hopkins School of Public Health, where they have a gun violence injury program. They're one of the national leaders in this area, to see how we can partner with them to really advance this work. Part of that is that I will be leading with the health department an interagency work group to address this. Our gun violence intervention team is modeled very explicitly on our opioid intervention team. There will be a range of agencies invited to this from across the county and the city, and we've invited the fire chief, the police chief, and the OEM chief to join us in this work. We are looking to launch that by the middle of March, if not earlier. There is a preliminary report that is out, that is available on the county executive's website. We will be finalizing a final report that will come out in May, and that will guide our work going forward. That final report has a number of recommendations. We'll be assessing those for cost, feasibility, and impact, and also augmenting those lists of recommendations based on emerging best practices, and looking at what is evidence-based and looking at what is effective in other communities. It is not a static list. It is a beginning to the work that we need to do in this county, in this city. So there will be more on that, and we're looking forward to that partnership across the city and county that I think is deepening with both your administration, Mr. Mayor, and with the county executive, to look at how we truly partner to do this work. And then the last area I wanted to talk about was health equity. We are looking very seriously at health equity, and all that means is that everybody has the chance to achieve their best health. Once again, it's one of those things that sounds good, takes a lot of effort in practice. Sure, happy to.
I may have missed it, but would you speak a little more to some of the efforts that the county is going to assist in mental health?
I will get to that in a minute, if that's okay.
Okay, that's
talk
fine.
about health equity, and then I
Okay.
can talk about that. So when we're looking at health equity, we're looking at how are we identifying what those disparities in health are in the county and the city across geographic, income, and then racial and ethnic lines. We know that generally those are the big determinants of how people are going to do in terms of health outcomes, in terms of life expectancy. One of the interesting challenges that we have in Annapolis is that the way that we can even look at communities blends together areas with very low income and very high income, and creates misleading patterns of understanding what is happening. What that looks like, and you know this city, you know that you can go a quarter mile and go from public housing to $750,000 houses. Unfortunately, that averages out to a pretty reasonable house price, right? But that doesn't reflect the lived reality of people. And so we're working really hard to look at how we can better understand what's happening, how we can look at what the issues are. We've talked about the distinction in opioid overdoses and deaths, and what they look like in the city versus the county, and how and how those different trends might be addressed differently. So we're committed to this, and we're actually standing up an Office of Health Equity and Racial Justice to address this. We're looking to get funding for this in our FY21 budget, and then we'll be standing that up. Our goal is to make sure that health equity and racial justice are embedded, not just in the work of the department, but in the work of county and city agencies, and also in the work of all of our partner organizations throughout the county and the city. And the reason that's really important is that it really doesn't make a difference if we do it in the health department or not, right? Like by ourselves. This has to be something that we are committing to as a county, that we are going to do this, that we are going to look at how do our health measures stand up, right? And the reason I mentioned income, geography, and racial and ethnic as the 3 dimensions is that those 3 dimensions are generally captured. No matter where you are, and if you're receiving services, those things are generally captured. Geography is, and race and ethnicity is, income to some degree. And we see that there are differences in health outcomes across those. So when we look at our health statistics as a county, we do well in some areas, we do okay in some areas, we don't do as well in others. But in order to really get a good sense of what we're doing, we have to break those down. We have to see where are we doing really well and where are we doing not as well. Because remember, everything is an average, but everybody isn't average. And so that's a commitment that we're making. In mid-April, I believe, we'll be releasing a report on health equity that we previewed at the Healthy Anne Arundel Coalition meeting that will go into some deeper detail around what it looks like in terms of our health outcomes when we break them down along those various lines.
This is in regards to the health equity. Would you speak a little more in depth about like infant mortality rates and the disparities between African Americans and whites within the county?
Sure.
And prenatal care and things like that? I met with a friend when I first got elected who works for the Anne Arundel Medical Center. And we just had a really good conversation about the differences in the communities and how they receive that care, and how we've seen a higher rate of deaths and infant mortality in our communities. Could you speak to that and how the county will kind of play a role in fixing that issue?
Yeah. So infant mortality, the reality is that there's not a lot of infant mortalities in general. And actually, what we saw in the last year that we have data, that the infant mortality rate for Black babies is the same as white babies now. But I don't think that that's actually the best measure because of the small numbers that we're talking about. We actually also are looking at low birth weight, which is also a marker for poorer health outcomes in the long term, and that still shows a significant disparity between Black babies and white babies, with the rate over 2 times for low birth weight for Black infants as opposed to white infants.
Sorry if what about just Black women in general? And like we hear stories all the time about the differences in care that they receive, and sometimes the pains or issues that they express are often looked over. Do you see that as a trend in our county, or where we have higher death rates maybe for African American women, or just any unusual trends?
Yeah, so we're certainly well aware of those experiences for African American women. One of the challenges we have is there isn't a really good way to measure that. When we look at maternal mortality, and I just got that data a couple of weeks ago, there's virtually no maternal mortality. That's not the best way to measure it because it's such a low frequency event. When you look at it across the county, there's been 1 maternal mortality event in the past year. So it's hard to tell, if it goes to 2, it's hard to say what's causing that. Is that just we had a bad year, or is there a trend in that? So that's one of the reasons I bring up the low birth weight infant, because it reflects both that maternal care, right? And it gives you a sense of what's going to happen to that infant growing up. And there's a lot more babies born. The vast majority of babies live. And so I think that gives us a better sense of what is going on in terms of care for prenatal care and disparities in prenatal care, and then also those birth outcomes and the consequences that come from that. So that's the measure we focus on for that reason. It gets to the same place though, but gives us a much better lever with which to work.
So do the The hospitals obviously collaborate with you guys in making sure that information is accurate and transferred over, and that any incidents like that are reported and followed up on.
So in terms of mortality and birth weight, those are all required. Those are all required pieces of data collected by the Maryland Department of Health, and that's actually where we get that data from. The question that we're trying to figure out is really what's the priority level on this, and how do we make sure that there are programs in place? I know that Anne Arundel Medical Center is opening up an obstetrics program to try to address some of the need in the community, and we were just meeting with them earlier this week to talk about how they're going to do that, how that care is going to be appropriate to the communities here in Annapolis, and how we're going to look at those measures to see if we're making a positive impact on them.
Alderman Turner is next. Sorry.
Oh, thank you, Mr. Mayor. Thank you, Dr. Kalyan-Naraman. I hope I didn't butcher that. I actually had the pleasure of hearing you at the caucus meeting where you were unfortunately detoured on the flu for about 15 minutes of why don't we have a mass and all that. I was just curious on the gun violence and the evidence-based research. Where are you looking when I look at evidence-based data? You probably want to go to where it's been successful. So I was curious on where you would be getting that good data from based on, good evidence.
Yeah. So part of that is, a couple of things. I mentioned that we have a preliminary report. Our first job is actually to go through that and look at what are the evidence-based practices that will fulfill some of those recommendations, and honestly to see if some of them show that they're not effective. We will not be carrying out things that have been shown to be ineffective. That's part of our goal with talking to the Johns Hopkins School of Public Health is to look at working with them to help cull through the evidence as to effective programs. Effective programs are going to be across a wide range of things. They don't have to relate to guns at all, frankly. Suicide prevention programs certainly will be effective. Reducing interpersonal violence is going to be effective. The gun piece is just a part of that. It's an important part of that. Obviously, it increases the lethality. But those are programs, there are evidence-based programs that have been shown to decrease violence, decrease suicide. There are gun-specific programs, for instance, identifying people who have suicidal ideation and also have a gun, offering them voluntarily giving up their gun until they feel like they're ready to have it back. There's no coercion, there's no anything. But those kind of programs can reduce the lethality. So it's looking through the literature, talking to other jurisdictions. There are not a lot of other jurisdictions who are doing the work that we're doing, but talking to those that have and understanding what it is that they've done and implementing them.
Well, thank you for being in the forefront then. Thank you very much.
Alderman Arnett.
Thank you, Mr. Mayor. I'm looking for ways to bring this home to us as policymakers, budgeteers, and I want to focus on low birth rate. I think race is maybe a masking variable, and so underlying that, would it be things like nutrition, heredity, lack of prenatal visits, and if it's the latter, is that something that can be addressed through transit systems, things like that? I'm trying to figure out how we can be more directly involved in thinking about an issue like that.
There are a number of things that go into maternal infant outcomes. I talk about low birth rate precisely because there are so many babies born, and you can actually see the effects of your interventions. Race is a part of it. It's also a prism through which some of these services are or aren't available. One of the biggest things we hear about is the type of care that is received and the lack of
race in the genetic sense or race in the socioeconomic sense. I mean, if
generally it's in the social sense, because it's in the social
Right.
the socioeconomic sense, and the disparities of care experienced by women of color, African Americans, and Hispanic women.
So, again, for us, if it's something like inability to get to routine prenatal care because there's no transportation, that's something where we can start thinking about that in terms of our transportation, bus routes, things like that, or other kinds of things like subsidized cab fares or Uber fares. So, I mean, I'm not asking you to expound on it now, just to do a whole dissertation, but I think what would be useful to us, or to me at least, from a policy perspective, is what are the kinds of things that we as council members could actually make a difference on.
Okay, we are certainly keeping that in mind as we go forward.
Pendel Charles is next.
Thank you, Mr. Mayor. I have a couple of comments and a question. Back in June, we had a Street Corner Ministries Coalition meeting. We had a young lady from one of our departments who indicated that as a new mother, that she was going through some things, basically like any new mothers. You know, how do I do this? How do I do that? And also some mothers that had already gone through some things. So I'd spoken with the mayor about this a couple of months ago, and we have decided to do two things. Number one, have a city Facebook page that goes through rec and parks, where people have an opportunity to bare their soul, for lack of a better term, as new mothers and fathers. And the other thing we had talked about was having a TV show where we would have a prenatal host as well as a birth to 5 host. I know with the school system, that's something that we are really, really concerned about, birth to 5. And the name of the program would be A Child is Born. And so this was something that I talked to the mayor about, and he was very excited about that. So that's something we're going to be doing to address that, because everyone tunes in, a lot of people tune in, and we figure at least that'll be a preliminary way of addressing the prenatal as well as the birth to 5 issues. The other thing is, I had gone to the launch of the Wellness Mobile for the county, and you and I had a 2-hour conversation, and I took you up on your suggestion. Dr. Nash had indicated that that might be something that the city might want to embark upon. So I did talk with our fire chief as well as our deputy fire chief, and according to and as well as the chair of the Eastport Volunteer Fire Company, and apparently within the next year or 18 months, we're going to have a couple of medic units going out of service, and possibly we could have them outfitted to have maybe a mini wellness mobile that could go from neighborhood to neighborhood, community to community. We'd have to look at the cost, of course, but that is something that we can parlay, that we can look at the county as nothing that large and well-equipped, but something on a smaller version that could go from community to community. Number 3, and you and I had talked about this, Dr. Nash, when we looked at the first Guiding Coalition meeting at the census tracts versus looking at zip codes, because someone had come to me several months ago, one of our partners in the city, and indicated trying to get a federal grant, they look at zip codes. And so one of the things that we wanted to look at instead, or at least try to move toward the direction, or at least the federal government, is for them to look at census tracts instead. And Dr. Nash, could you kind of give us some information concerning that and where we possibly could be as far as even looking at our federal government and our Congress and our representatives?
Yeah. So the question about zip code census tracts, the reality is that different federal agencies use different ways to assess what a community is. Some use zip codes, some use census tracts. There's no uniformity to that, unfortunately. The reason we selected census tracts, is that they're smaller than zip codes, and they give us a little bit better sense of what is going on. Census tracts still don't observe lines of how people actually live, right? And so that means that they're going to necessarily blur the lived experience of people, but it's what we have, unfortunately. We looked at how we could potentially determine what a community is for throughout the county, and the reality is that there is no standardized definition of what a community is. To boot, there are communities and then there are spaces between communities. So that's not something that we could use to measure what's happening in the county in a way that we might understand better. One of the things that we had talked about in terms of providing healthcare services in the city is looking at down the line, moving towards getting a federally qualified health center. For those of you who are not familiar with it, Bay Community Health in the South County, Total Healthcare over in Odenton, Chase Brexton and Glen Burnie. They're examples, and what they do is they provide care rooted in the community. Their boards are supposed to be at least 51% of people receiving services. They take everybody regardless of ability to pay. And they're also preferentially take Medicaid patients, which is an important access issue that we see. A federally qualified health center, FQHC, is the...
And you have to get a private business to qualify for it, and then they go get tax credits.
It's actually the way it works is that it's a independent nonprofit. And it actually gets money. It gets money through the federal government through the Health Resources and Services Administration, or HRSA, HRSA, and it's a way to address healthcare access needs. The biggest problem we have in Annapolis comes down to the census tract and then the way that they measure the need. We are working with our state counterparts to try to figure out how we can better quantify the health needs in the city, because right now, just based on the way those calculations are done, there doesn't seem to be a need in Annapolis City. And as I said, that doesn't reflect the lived experience here. And so we're trying to figure out, is there any workaround to this?
And would you be able to look at, like, because that raises a very, very interesting point. Like, I mean, the only health options in terms of, like, if you need care, there really are none within the city. You have Right Time, which is Best Gate. That's not the city. I believe there is one on West Street, the Prime Care or something like that. It's in your ward, I think, Rhonda, maybe. No, maybe
We've had
not.
a couple of them, small, medium,
Yeah, and then the
closed,
hospital.
open.
So I mean, that shortage of healthcare access within the city and within distance for people who can actually afford it. I know that has to affect the numbers in some way that stands out where we would be able to advocate for some sort of significant funding to provide those needs to our communities. So the federally qualified health centers, is that something that the council will go after, or is that something that is done by the state and county, and then we would just maybe lend a voice to that?
Generally, those are done through private nonprofits. There are some rare instances of health departments partnering to create those, but those are complicated. I've seen many stood up. I didn't mention that my 13 years prior were in community health prior to coming here. So that's the world that I come from, is how to deliver care in a community setting. I'm happy to talk more about what that might look like and how we would be able to advance that conversation. And I think that there are ways that we could convene folks in the city to look at where there might be capacity to try to launch such an endeavor.
Dr. Knowledge, is the Parole Health Summit an FQHC?
No.
Okay.
No. Nor could it be at this point. The Parole Health Center right now provides two services. The health department, we provide preventive services, a limited range of preventive services, and then on the bottom floor is the daycare. So in order to be that, you have to provide a wide range of health services, including primary care, some behavioral health, and family planning care. So it goes well beyond what we do in any types of service delivery through the health department.
Would the outfitting of a city wellness mobile kind of address what Alderman Gay has suggested, maybe?
It could.
It depends on what it would be incorporated within that vehicle. Okay.
Yeah.
And that would be something that the county health department, and you indicated, would help us with doing.
Yeah, I'd love to at some point pull together a few folks to talk about this and to think through what that would look like. There are a wide range of FQHCs throughout the state that I think might be quite informative.
Okay, great. Thank you. The other thing is too, as far as the census tracts and the zip codes, like you mentioned before, we have communities of poverty sitting right next to $1 million homes, and that's the real challenge of trying to get any kind of grant money. But okay.
Yeah.
Okay. Thank you.
Was it me? Yeah. Real quickly, I know there's an effort to establish the first. I know people know of them as halfway houses for alcoholism or opioid. I believe they are looking at a location in Ward 2, perhaps. Are you involved in that at all, or in that
Generally,
effort?
we're not involved in the siting of those kinds of healthcare facilities. All of that regulation is done at the state level. We ask that people partner with us so that we can make sure that they are doing the things they need to do to deliver good care and integrate well into the community.
Right.
Because I know that it's one of the issues is that when service organizations, particularly doing substance use disorder treatment, don't work with the community, there can be a lot of problems that come up. But we don't regulate that. We can neither restrict nor push one of those forward.
Okay. Thank you.
So, but I believe there's 3 or 4 halfway houses in the city. Is that right?
I think it's more than that.
Yeah.
I got like 2.
Yeah.
I've got several.
Well, this is different, I think. This is more like Chrysalis House.
Okay. Sure.
Okay, so a residential treatment center.
Yeah.
That would be different. But yeah, there are halfway houses, there are recovery organizations that are located in the city and throughout the county.
Yeah. Angel is the one Angel is working on.
And does
She
that have
has
to
a
be?
few in the city.
Does that have to be licensed through the health
Yes.
department? That does. Okay.
That and not through our department, through the state health department, actually.
okay.
Yeah. For halfway houses, just so you know that there is regulation, but there are also some that just function on the down low as halfway houses, and those are not regulated because they haven't gone through the licensing process.
Right. Right.
And those are what they are. We have nor anybody else really has any say in them.
Yeah.
And
Okay.
the Anne Arundel Medical Center facility that's on Forest Drive near Spa. What's the specifics of that? Do you know if that's serves a sort of underserved population in that location? I've been to it once or twice, I think. So.
Yeah, I've talked to them about it. I'll tell you that I haven't been there, but I've talked to Tori Bayless about that location. I think that the issue that I've heard, that my understanding is that while it welcomes serving the entire community doesn't feel welcome to go there. And so I think that gets to the issue of healthcare access and access that's geared and in tune with the community it's serving. And I think that's some of the breakdown that I've gotten about that center.
On we go.
I have 2 last questions. I'm sorry. This is why I'm such a big fan of the work sessions, because it allows us to, gather the information that we ask on a daily basis in one setting. So the first is I'm just checking out the website and behavioral health, and it talked about like the services that they're providing for juvenile services and all that stuff. Could you go in a little more in depth on that? Because it usually overwhelmingly affects African-American teenage boys, especially in middle and high, where just because you don't sit still in the classroom, you are prescribed and medicated, and then that stuff kind of impacts the rest of your life and development. Could you talk a little bit about that and how the county has kind of taken steps to assist in that area as well?
Sure. So you had actually asked a question earlier about mental health, and I'll include that in this. So there's the function where we provide care, and then there's the function where we, in partnership with the mental health agency, oversee the mental health care that's provided in the county and push out best practices. So in terms of service delivery, the adolescent and family services we provide, mainly in Glen Burnie, we just started recently down here at Bestgate, providing those services. But more specifically to your question, that gets to questions of accurate diagnosis, biases in diagnosis, over medication, and that's something that the professional societies are working on right now, and we partner with them, particularly the Anne Arundel chapters of the American Academy of Pediatrics and Family Practitioners. Those are the main ones, because frankly there isn't enough psychiatric care available. The waiting list for that is extremely long. Whether you have private insurance or Medicaid, it doesn't really matter. In fact, it's sometimes easier to get in if you have Medicaid. That's for adults. For children, the wait is just long.
So that's just such a good point, because, it's something to take serious, the mental health aspect of all of this, just because it's something that's obviously been affecting people for years, but now it seems like it's something that everybody is kind of switching over to and talking about and feeling comfortable talking about their diagnosis and things like that. And you're right, it's ridiculous. It's impossible to find mental health assistance within this city, especially in a timely manner when you talk about something as sensitive as mental health. I mean, 12 o'clock, you could be fine, and then by 4, you could be going through, suicidal thoughts or just mass depression. Mm-hmm. And to not be able to find the assistance necessary to cope with that is such a problem, especially in, again, our communities that are high crime, high poverty, when you're dealing with those things every day. I think I've seen recently that the county partnered with Anne Arundel Medical Center to start offering more assistance there. But how do you, just based off of experiences and hearing stories from people within my communities and stuff like that, the process to them, it doesn't feel like you're getting mental health treatment. It feels as if you are like at the old hospital in Crownsville or something like that. So it really hasn't progressed much, the treatment that you receive. So how do we get ahead of the curve and really, act on that?
So there's a couple of different threads in there. One is, how do we get care for people when they need it, right when they need it? And the reality is it's really hard. I don't have a good answer at this moment for you, but nobody does, because we're all struggling with that. That's why the mental health agency has a warm line for people to call who are in crisis. That's why we have the safe stations. Those are really good ways to get people down from a crisis moment. But then what happens next is much harder. For people who are in severe crisis, going to the hospital or being taken to the hospital is oftentimes just exacerbates the problem because of the wait times there. But I think the other part of your question, if I'm getting it correct, is also about care that resonates with people. And I think that also reflects a gap that we see in terms of who enters the profession, and having culturally competent care matters a lot, right? That's part of why when the mayor had asked about the Forest Road site for Anne Arundel Medical Center, it's available, but it's not necessarily in tune with the community, and so you have something that people don't feel like it's for them. And I think that we see that same thing in mental health care as well. What I would ask you to do is contact me. Let's talk about what that might look like, because the only way we're going to be able to get at it is to understand what is the gap, right? Like, what's the exact gap? I'd love for people to use that warm line, use those crisis services. If they're working for them, good, and then we have a general problem anyway. If they're not working, then we need to understand why. So that would be my ask of you.
Thank you, Mr. Mayor. One thing that I can indicate to you with Anne Arundel County Public Schools, I think they have 6 organizations that they have partnered with or that they have MOUs with to provide services to children, students, right in the school setting. I don't know if it goes as far as the family. I'm not quite sure, but I do know they partner with the Children's Guild and Arundel Lodge and several others to provide children's services right there in the schoolhouse during the day.
So, and with the craze of medical marijuana, and just seeing the effects on how it's helping individuals, how do we also get ahead of that curve? I know that we have a couple dispensaries in the county that offer their resources, but how do we, enhance that as we also fight this battle of the opioid crisis? And we've seen the effects of the over medicating and that, and how this plant can, do what 10 or 18 pills can do. Like, how do we find that balance to start to push, I guess, educate our residents on the importance of getting away from opioids and things like that, and looking into alternatives routes for medication.
Mm-hmm. So, I mean, we have a number of programs and interventions that are going on throughout the city. We have our harm reduction AA Power, which I believe launched in Annapolis about 3 months ago now, to provide education on not just opioids, but also how to engage in treatment, harm reduction. We've been doing what we call academic detailing, so going to doctors' offices throughout the city and county to talk about ways to reduce the number of opioid medication, the numbers of pills provided, really, and what are the alternatives to address chronic pain. I mentioned the Wellmobile. Our goal is to provide treatment, what we call treatment on demand, and to bring that to Annapolis City. We know that there's a shortage of providers willing to prescribe Suboxone and methadone throughout the county. It's not a city-specific phenomenon, but it's something that we're working on really hard right now with the 2 hospitals, at least, in the county. And we're also working more with Harbor. I know that doesn't affect the city as much, but for us at a large scope, it does matter if we can get more treatment into the county. So those are kind of the 3 of the larger ones we have. We're going to be relaunching our opioid intervention team, so that we can continue to focus on how to bring down those deaths and those overdoses, frankly. So it's a continued multi-pronged effort to get at this issue.
Charles?
Thank you. Just to put a plug in, I know that the city is very involved in the harm reduction and the AA Power, at least through our mayor's office, so that has been extraordinarily successful. Mm-hmm. So we thank you all also for the grants that you have provided to us in order to do the work that needs to be done. Thank you so much.
I was going to ask where you came from. Where, John Hopkins, I heard?
No.
Or, no.
No. So I'm a primary care doctor. So prior to coming here, I provided primary care for 13 years in community health. For about 4 years in DC at a community health center, both there and in the jail. And then for the past 7 years in Baltimore City, County, and Hartford County at a healthcare for the homeless. So the work that I've been doing has been rooted, as I mentioned, in community, and this is more on the prevention side, but pretty much the same thing.
Yeah. Wow. Thank you so much.
Do we monitor? Okay. You just mentioned jail, and I know we have at least in our city, the Jennifer Road Detention Center, where a ton of our residents go. Do we monitor the health care that they receive while incarcerated?
So yes, and sort of. So we monitor that. There's 2 facets to that. One is the provision of general services, and the second is of substance use disorder services. So the jail itself actually contracts to provide those healthcare services. It's their responsibility to do so. They are the ones monitoring that, and we have been talking to them about getting those health measures and seeing what they're doing.
So if there is serious issue that takes place, it says Anne Arundel County Jennifer Road Detention Center. It's no fault of the county then? It'd be the fault of a third party?
That's how it's currently constructed. Yes.
Is there no oversight in that to assure that to ensure that those being housed in our county serving time while they're incarcerated, they're receiving, they're still humans, that they're receiving the best care, not just, how do you, as a government, how do we ensure that they're receiving the best care?
I'm not saying there's no oversight. I'm not saying it's that third party's responsibility entirely, just that they're the ones delivering the services. It's our job to oversee that and make sure that they are delivering the services they're supposed to. And
so do they give you like a yearly report that says, I don't know, this is what's been happening in the jail. This many people had headaches or whatever. We're prescribing this much and we're using this. Is that something that because it would be concerning to me that individuals could be needing treatment or going through significant health issues and they aren't receiving the care that they should.
Right. So the measures we look at, so there's a couple of measures. One, a good number of people are not in jail for more than 14 days. So there are measures on how quickly you receive your initial services. A lot of the folks there don't make it to that 14 days, right? Like they're released. And so there are a couple of touch points up to that 14 days to make sure that your immediate, if you have any immediate needs, that they're stabilized. So we monitor that, make sure that everybody gets that initial touch. Identify anybody with chronic diseases, anybody who has medications, get them on those medications. And then for those who are staying longer, if they're going to be at Jennifer Road, if they're there for a year or less, or they're pretrial, right? And otherwise they're going up to Ordinance Road. And then we're monitoring, are they getting the services they need? Are they getting the medications they need? Outcomes are a little harder to look at. We're looking more on making sure they're getting services and there's no adverse outcomes. And so we are monitoring that.
But there is no official policy in place from the county that says we have to, at some point, look at the care of inmates at the 2 facilities that are in our county?
I don't think that's correct. It is, right. We have determined what it is that we want the health services to be delivered. That's why we've incorporated the need to provide medication-assisted treatment, the need to provide birth control in jail. So we're constantly looking at, okay, what is it that we need to do to improve the health? So I guess that's, I'm not quite getting at where you're going with this, because we're monitoring it. We work very closely with both Bill Martin and detentions to make sure that folks are getting the care that they need, and that when they're coming out, that they're getting connected to the services that they need. So one of the things that I've been focusing on is making sure that when people come out, they get connected to primary care. That's not happening as reliably as it needs to. So that's an area, to your question of oversight, that's an area that we're looking at right now to look at how we can improve that.
Thank you.
So thank you, Dr. Nash. We're very lucky to have you. We really, thank you.
Thank you for the opportunity.
Thank you so very much.
Good to be here.
The health department also inspects our restaurants. Thank you.
Mr. City Attorney, please present the next item on the agenda.
Yes, sir. The next item on the agenda is an update on the comprehensive plan.
Our newly appointed Planning and Zoning Director will make the presentation.
Good going. Just came up for a second.
While we're waiting for the technical difficulties, before we get to the update, can we talk a little bit about a back date?
Yes.
Okay. We'll do a magic show while we're waiting for that to. In terms of back date, I've been attending a lot of your outreach sessions, and I was struck by some of the things that you said, including the themes of the comprehensive plan. I think one of them was healthy city and so forth. And I wanted to talk about how we decided what the themes were. And I remember particularly on healthy city, that was one that seemed to subsume a theme that is very important in my community called traffic. So is there a source we could go to, or could we finally have a joint meeting with the Planning Commission where we can go back to sort of first principles and talk about what we see accomplishing with this? We had that really good dialogue last night or yesterday afternoon about things could be in the 2020 comp plan and things that might already need to be thinking about in the 2030 comp plan. So I read through your update and it's very helpful, but I think there's other, as I call it, backdate kinds of things that we need to talk about.
Sure. Okay. Well, first, I'm Sally Nash, and I have with me two members of the Planning Commission, Bob Waldman and Alex Pine. Thank you both for coming today. As far as the lenses we're using to filter some of the ideas in the comprehensive plan, they're resiliency, healthy cities, and housing. And those were based on some preliminary conversations I had with Planning Commission and city staff, three main issues that everyone felt we were dealing with in the next 20 years. And by healthy communities, that I'm including public safety and quality of life issues. Mm-hmm. So it's pretty comprehensive. Housing has its own chapter in the plan, but both resiliency and healthy communities, there'll be a small section in each chapter devoted to those specific themes. So again, hearkening back to the conversation at Environmental Matters yesterday, it feels like we need to have better established processes, like when we were talking about the Greenway and the WE was mentioned, and council members didn't know what the WE was, and things like that, and sort of maybe we need to have a resolution that talks about how we should have a Greenway plan, and then maybe the subset of that is what is the WE, how does that interrelate with it. I've always been struck that the comp plan comes to the council last. After it's all done, and then it comes to the council, and then we start giving our input. And it really feels that that is begging for trouble, but is just not the most productive way to do it. It really does feel like we should have been much more at the front, gotten some buy-in, ownership, as it were. I do like this process that we're doing this time, where the staff with consultants are working on the fundamentals of the plan. You are the planners and the experts, working iteratively with the Planning Commission. I've always felt the missing piece there was the Planning Commission and the council working iteratively. So we're sort of brought along with the process, so it doesn't get here and there's this quick read like cramming for exams the day before the council meeting where we're going to adopt or not or amend the comp plan. So I really do urge again that never too late, but that maybe we do need a step back process to get involved and get the council inculcated in some of the early thinking about the structure and the goals of the comp plan.
That would be great. However you want to do that, I'm happy
Well,
to.
I think Mr. Waldman sent an invite to the council to meet with them months ago. I happen to have seen a draft of that, but the council never got that invite. So it never came to us. I think there would be many of us on the council that would have welcomed a meeting. How many months ago was that? It must have been, it could have been a year ago. I mean, it was certainly, it was many, many months ago. And I think that it would be good to do this, especially because I've been watching, and you're going to tell us about it, all these different outreach things, and I keep saying, when are we going to get our outreach here at this round table?
We are listening to your constituents, Ross.
Right, yeah, right.
And there is also something on the next work session agenda as well. So that's, I think there was a lot of scheduling issues, so a work session time is generally the ideal time if possible.
Set it up. I mean, it's fine. I remember standing at the lectern a few months ago and asking every single ward leader, to talk to us and to think about what you want in this plan. And here we are. This is the third time we've been here.
Yep.
And I agree with you that from the beginning, and it's been Dr. Nash's strategy from the beginning to incorporate the council from the beginning as much as possible. You guys are busy, you're distracted, but I think everybody's beginning to realize the importance of this. So if we can organize some kind of useful, collaborative kind of atmosphere.
But is it this format you want? I mean,
Actually,
I feel like
what I was thinking.
You've been probably at every single thing. So
Far. I hope so. I
Mm.
had tried not to miss any. I was actually thinking of having a collegial setting at the Blue Heron Room over on Quiet Waters Park, where we could have maybe a box lunch and we could talk about it in a much more informal, less structured. It would still, I mean, if the Planning Commission is inviting us or we're inviting them.
That's a good idea.
I prefer it that the commission invites us, but and we can now have the cameras so we can record that. But I just thought, this is so structured and we're up here and you're down there, and I want us to be at the same level, having a dialogue and getting your thoughts. I mean, we've now seen a lot of things, like we saw the thing on form-based zoning, we saw the thing on the strong towns. I'm reading the death and life of cities.
We're looking to get Shelley Rowe in to talk about transportation.
Yeah.
And the difficulties of forecasting transportation.
Yeah.
Outcomes.
No, all of those kinds of things. So we're with the flow instead of all of a sudden getting the fire hose of information. And,
Right, so you're going to set that up?
Yeah.
I'll organize the food. And the location.
Just real
Tony?
quickly, I'm trusting the process as far as you reaching out to constituents. I represent constituents, and through neighborhood associations, I know they're talking and going to meetings. That's sort of how I'm working it, and I want to hear from them. I'm not going to make decisions for them. So is that the intent of the reaching out to the communities? And yeah, okay. So
But it's probably helpful to give you
an overview.
more information as soon as I get it instead of
Well,
all at once.
Yeah.
at
What's
the end.
helpful is the weekly update on email too.
Yeah.
Right.
The
the
signing up for that.
The things that we haven't let you talk about yet that are in here, I think there's a lot going on with our constituents, and that's all good. But ultimately, it's going to come to us to
Yeah.
adopt and approve.
See, I'm pounding them on the head to get involved. So that's how I'm trying to go, the process is working that way. I think I got somebody on the nitty gritty. I'm not sure. Anyways,
I don't think so, or
I don't know.
I don't think so, but
Yeah, I should.
yeah.
So, Sally, and I want to make sure that comparatively, compared to 10 years ago, we can say that we did twice as much outreach as we did back then so that people feel involved. Because that is always the complaint. We can have dozens of meetings and advertise it and film it and telecast it and all that, and still people always say, no one told me. So I don't know how we can...
I think we're doing a different kind of outreach this time. That was that cluster of people that all met in a room once a month or whatever. This is much more broad-based.
Okay, great.
I think it's going to be more scientific if we get into the matrix-based decision.
The goals and the strategies.
Yeah, so we have kind of a similar system to measure across different populations. So the same questions are asked, and I think it's going to be very interesting to see different outcomes from different communities. So the more people we can get involved in that process, I think the better and the stronger the representation is going to be of the will of all of the people. So, and when you see Sally's numbers already, and we still have a way to go, there has been considerable amount, I think a much broader based amount of outreach than ever before.
Thank you. Great.
Okay. All right. Just this is what I'm going to talk about today. The last time I was here was June. So since that time, we've been working a lot with our resiliency group. This picture shows resiliency when you bend with the wind but don't break in the storm. I like that image. We're looking at this group, which was organized with the help of the University of Maryland, looked at city assets and what climate change factor they were especially vulnerable to. And then I also had them include goals and strategies to protect each asset. For housing, I've been working with a lot of local housing providers and associated programs such as Angel Trainer and Serenity Sisters, as well as state efforts. They're doing a regional housing needs assessment plan right now. It's more big picture and especially focused on homelessness and extremely low income, but relevant to the city as well. Also been participating in the Forest Drive Eastport Sector Study Task Force. We've had 5 meetings so far, and I think this group is a good model for a new way to formalize intergovernmental cooperation, because we can't implement the plan without help from our other agencies and partners. We've had 28 meetings, and yes, our meetings tend to be smaller this time around than last time, but I'm trying to be more strategic about who I meet with, so the people I meet with can tell other people in the community what's going on. I've had 3 specific planning commissions where I've updated them and discussed the comprehensive plan with them. I've been to 4 community associations, and I have a couple more planned. I've been to 2 town hall board meetings. Happy to come to more if you just let me know. Our resiliency work group meetings, housing meetings. I've had 1 information session, the Ford Mace Code, that I think all of you were there. Almost all of you were there. We're setting up another one for March. Jackie Gild is going to speak about resiliency and other things that the Office of Environmental Policy does. And then in April, I'm hoping to get Shelley Rowe to come talk about transportation. And we just started the Nitty Gritty Committee, which is my group of very dedicated volunteers. Right now, they're helping me look at the policies from the 2009 Comprehensive Plan that weren't implemented, and whether we want to continue them on into the 2020 plan and keep them a high level of importance, or if, maybe they were important in 2009, but things have changed, economy is different now, we're not really going to put forward all the same policies as before. So I'm trying to get a sense from them on those 2009 policies now. I'm struggling with how to collaborate online because not everyone has a Gmail account, so it's frustrating because it would be very easy if everyone had, almost everyone has Gmail, but not everyone. And then this week, we've had meetings with all of the department heads to discuss their services that they provide, how they account for those services in their capital budget and operating budget, and how those costs might be impacted by different kinds of development. For process, again, working with surveys, doing presentations, working with community groups for this, with this on-the-table toolbox that gives them sort of a starting point for what to talk about and what to address, as well as some background information on existing conditions. I'm gearing up for a big public meeting in April where I'm going to get all of the goals and strategies that we have so far from our boards and commissions and our community association groups together to all be evaluated together. Also want to do a visual preference survey at that meeting. Then after that April 30th meeting, we'll be narrowing down some of the goals and developing the performance measures and performance targets so we can have a way to measure implementation of those goals and strategies. And then August, again, another public meeting, and then September, hoping to come to you with the draft and start working on that through that process. So in addition to preparing for the 30th, I have my second meeting tonight with the chairs of the city's boards and commissions. This is a great group. They work so hard, and I've already gotten some goals and strategies from some of the chairs that are just really great and perfect for the comprehensive plan. They really get whatever their particular focus is. They really understand that topic, whether it's the Recreation Advisory Board or the Human Relations Commission or.
Excuse me, Dr. Nash, did you want questions at the end?
Go ahead.
I can save them to the end.
I'm almost finished.
Okay, I'll save it.
I have, as I mentioned, more information sessions coming up, more planning commission meetings, more nitty-gritty committees. We're going to be meeting every 2 weeks, although the second meeting of the month will be a co-meeting with the planning commission and generally these information sessions. Happy to come to any community associations. If you know of anyone who hasn't heard from us, we're happy to come out. And I would like to encourage participation. So for the nitty-gritty, we had 2 people from Ward 2 at our last meeting. Not everyone could come, but we had 2 people from Ward 2. We had 1 person from Ward 3. We had 1 person from Ward 7. And guess how many people we had from Ward 8? 6. So Ward 8 is doing a great job getting people out, but it would be great to have representation from the other wards that weren't there, especially 1, 4, and 5, and 6. So, all right, just some other meetings we're going to, Arts and Public Places. The Environmental Commission is hosting a summit on the 26th that all of the nitty-gritty committee is coming to, and they're getting input on, from an environmental point of view, what do people want to see in the comprehensive plan. Coordinating with the Navy on resilience and especially sea level rise. Going to go to Tyler Heights, thanks to Mary Ann Arnett for organizing that, and another joint community association meeting And that's also, I'm ready for questions.
Just curious, thank you, Mr. Mayor. Just curious, with your boards and commissions, because we have about 25, I would imagine, can't imagine, were all of them able to give some kind of feedback? I mean,
No,
just curious to see what was
some of
maybe the
them-
most unusual feedback you got.
Some of them I never heard from, but some of them I did hear from, and they said, you know, it's just not really relevant to what we do. So like, there's a group that manages the city's pension or gives advice on the city's police and fire pension. You know, he called me and he was like, I just don't think there's anything relevant. And that's true. Some of them, it's just not quite applicable. Even like the civil service board, he came to the meeting, Tony Christoph, but he was like, there's nothing exactly that fits. So it's not every board and commission, but I did contact everyone. So, you know, that it fits into some of their missions more than others, but.
Okay, that's what I figured. Thank you.
Sure. And I did forget to ask Alex and Bob if you wanted to add anything.
First of all, I think, please remind yourselves that my colleague to my left is doing two jobs. She's getting this massive sort of comprehensive plan with all of these night meetings. She's running a department now, and she is running a family. So we're all quite cognizant of how well she's doing and how gracefully this is actually coming across. The second thing, I'm repeating my invitation that Dr. Nash and I will go to any community association and make a presentation, help them get started on this talking business, you know, and thinking about what it is they want to do. I'm repeating my invitation to you specifically to begin thinking about the things that you think ought to be in a comprehensive plan. And I think that that's a very, very important piece at this point. It's an interesting perspective that I got. You know, I think that needs to be absorbed. So those are, I think, the three most important things I have to say. I thought that the form-based codes that we all, you know, that was basically presented as out of this whole process was interesting. It was creative. It doesn't mean that we're going to put form-based codes throughout the entire city, but clearly there may be places where it makes a lot of sense. I mean, I began to think of other places where it could make sense now that you start to think about a template for way down in the future and putting the time in to see if that's what you think, you know, where places in your ward ought to go. That's all. Kind of say. What else could I say?
Thank you, and thank you for being here. This is a huge effort, and there's a lot of work that goes into it, and you don't want that all to be for naught. So I think what my constituents need to hear is a little bit about the implementation or lack thereof in a comprehensive plan. So to answer that, maybe you can tell us how it is utilized by the Planning and Zoning Department in their review of development projects, or is there a gatekeeper of it that's just sort of a check balance thing? I think it's a mystery on where this document lies in the Planning and Zoning Department, so to prevent, you know, a long list of non-implemented items. Is that a clear question?
It's not that long.
What's that?
It's not that long.
Oh, no, you want to prevent that. Yeah.
Right. So there's a couple ways a comprehensive plan is implemented. One, the recommendations go to the capital improvement program. One, the specific ideas get codified even more specifically into the code. And then when a project comes in, you know, the current planners are looking at that. But three is that certain projects it has to be determined that they are consistent with the comprehensive plan. And usually what happens is that the project manager refers the application to comprehensive planning. We review it. We look at the proposed land use that's in the comprehensive plan. We look at other policies that are in the comprehensive plan, and we write a memo discussing how it is consistent with the comprehensive plan and how it furthers certain goals in the comprehensive plan.
And I know the planning commission looks at it.
That's right. That goes into the whole review package, and that's sent to Planning Commission and other agencies.
And follow up to that is, I think you said the nitty gritty group was looking at the implementation of 2009.
Mm-hmm.
So what is going to be the lessons learned there? If something isn't implemented, are you carrying that forward and saying why and what can we do to?
Well, I have a big spreadsheet that shows all of the policies and generally what kind of their status, what they've gotten held up on. Mm-hmm. It's usually, as Diane Butler was joking, like it's usually money, but that's true. It usually is. Yeah. There's not money. But this exercise, which is looking at the things that were not implemented, mm-hmm. it will help us because some of those things are still really good ideas.
Yeah, like accessory dwelling units.
Right. Yeah, we just need to keep working on it and getting it right. Some of them, though, they weren't implemented because, remember, after the last comprehensive plan was passed, there was a huge recession. A lot of things that we thought were going to be the case in the next 5 and 10 years turned out to not be the case because of that. And so there are some policies from that plan that we look at them now and they don't really make sense given our current economic reality.
Arnett?
So I want to follow up on a point that Alderwoman Tierney just made, and it's one of the outcomes that I'd like to see from the comp plan. It hasn't escaped my notice that pretty much, other than in your offices, all the land use things happen right here. And I've often thought, I wonder how many people in this room can say what the 3 principles were from the current comp plan. And I've often thought that with this comp plan, I'd like to see, along with these yellow sheets that we have under the plastic thing, that there be another sheet that has the comp plan principles on it right here. So as we're doing all of the land use things, it's right there. You can't escape it. So I think that's important for us to think about as a goal. And when I was thinking about that, I thought, gee, we're being left behind, we the councils so far, and we really need to get into the game. I was thinking again about the presentation, the very provocative presentation on form-based zoning. And one of the things that struck me was in every one of the communities where it was employed, there was a huge, long, global effort to bring in all of the constituency groups over and over and over and over again. Mm-hmm. So I can see having in this comp plan the notion that we might want to identify a couple of areas in the city where we could think about form-based zoning. Mm-hmm. But I think that then if we're really going to execute that, you're going to need more staff. And we're going to need more time to do that. Mm-hmm. But the nice thing about those slides that were presented is you could actually feel them. When the slides came up where the buildings were close to the street and it was bounded, you could actually, it was palpable. Mm-hmm. And when they showed the broad intersections with nothing on there, so I think intuitively, if we can do things like that, all of the citizens will fall in line. I want to be that community too. I want to have those kinds of things. Now, I do worry with strong towns and all of these things, and I know even the Chuck Morrison said, everybody says that's not my community. We are a different community. We're not unique, but I think we have to think long and hard. First of all, we're not a community that grew up with the post-World War II sprawl. We were a community that started growing 400 years ago with the small shacks that he starts off with his hometown in his presentation. But I do think that we need to get more of us inculcated into that. I almost would like to see the form-based zoning and the strong town presentation done again just for the council at a work session with time for us to have dialogue on it, to talk about it. Because some of the things in small town are threatening too. When he said you'd like to be able to come in the morning and leave in the afternoon with a permit by right to change your single-family zone property to a multifamily property, I could just hear a bunch of sphincters tightening all over the city about that notion. So,
That involves some pre-planning, okay?
Yeah.
That involves looking forward. That involves a lot of time and a lot of effort to figure out what you want to, even on the selected properties around the town. Okay? And it's something Annapolis has not done well. It's been reactive instead of proactive. And it's whether, the council's willing, when the time comes, to sign the check, to get it done, to get the changes done in a zoning, to sit down, to get your leaders, your community leaders engaged in a process of deciding what to do. On West Street or at the Hillsmere Shopping Center. I could go over these places specifically. You want me to talk about the elephants in the room? No. But that's what it's about. And if that's where you want to take this, then that's what should get into this comp plan, and we need to get moving.
So I agree with all of that, and I do. But I think there's another thing, because I've been having dialogue with our new city attorney and talking about major reformation of our code, and moving a lot of things out of code and into regulations. And as you might know, I'm also working on legislation to create a hearing officer, which may have some ability to do a number of things, I hope, but certainly speed up the process. I think it also takes the monkey off the back of the planning staff to be in the middle of everybody who's angry and so forth. We'll see when that hits the streets. We'll see how that's going to do. But I think there's a lot of things that we need to be thinking about in the comp plan in terms of just how we do our code and our permitting processes, which all are falling on the shoulders of planning and zoning.
All right. If there's going to be a meeting, this is probably, a more informal session than, I have ideas that don't even need to be talked about here. Lots of us have ideas.
Honorable Attorney?
Let me bring up the elephant in the room. The Forest Drive sector study. My confusion is, I believe that was a good study. I believe that it incorporated form-based concepts, if I'm not mistaken. It actually spoke of what the speaker talked about as far as old lots, redevelopment, not new development, and optimizing the land in a form-based way. Am I correct? Mm-hmm. Okay. So we know that failed with the public for valid reasons. So how do we prevent that from happening again? Or what do you see as the failure? Because there is, Ross is saying that was a good presentation, but yet I think he had different feelings about the Forest Drive sector study. So maybe this question is for my colleague, I'm not smart on what that disconnect is. And I'm not talking about the very valid transportation issues. I'm talking about this approach to development where we now have an old liquor store, an old houses, albeit they're private properties. But my thought of the Forest Drive sector study was that was the approach to get this already developed land and optimize it the best way possible. I think there's a question in there.
So do you want to ask it of me or Sally? Because I will respond.
I guess so, because that is there's a disconnect there. Am I right?
Let me answer and then Sally can react, because I think the biggest pushback on that plan, which is something that I think the task force
Yeah.
is coming to grips with was we had all of these changes in community character, which is very much like form-based zoning, maybe a prettier version of it. And we had this potential for raising the height of the buildings, filling in and so forth. And there was I liked the whole implementation section of that. That was very much like what the big difference in this city doc plan from the last city doc plan was. You had the concept, you had the implementation schedule, and then you actually had the financing. And for the 12-13, we only had the first. We had the concept, not the timeline and not the financing mechanism. The big rub was, hey, we're going to get all this density, and we know we're not going to get any change whatsoever in Forest Drive or in transit. It's all, oh yeah, well, we're going to have all this, and yeah, we should be doing that. And I think by having the 3 tiers of government involved in that, having that dialogue and two-way dialogue. The first dialogue, the very first meeting of the task force, is when we heard from each of the jurisdictions, state, county, about, I think it was somewhat a little bit taken back why you even question this. Of course we talk to each other, and here's how we do it. But then we got into a little bit more where Ramon said at one point, I'd really like to do our traffic measures the way the city does it. And then I know that Dr. Nash has an even newer way that we would like to do it, which I think will eliminate some of the confusion about A through F and that sort of thing, but also I think could be more pragmatic. So I don't have the sense that any of my colleagues have said we don't want to adopt the 4-sector drive. I know I'm in favor. I'd like to see some amendments to it, but I think that it's very important that we bring that back to the council, to the committees, and have a new resolution and talk about repairs, and I think we'll have a better understanding of it at that point. And, you know, I think you might have already noticed today some changes in perspectives just because of the presentation on the form-based zoning. I don't think there's anybody on the council that's unreasonable, but I do think that we need to be brought along and educated just like everybody else. In reality, other than winning a popularity contest every 4 years, we're no different than any of our constituents, no different than Jim and Frida sitting back there dutifully going through another presentation at the council. Where are all the other residents?
Are troopers, yes.
Yes. So, you know, we're just like everybody else. We need to get used to the ideas and see the value of it and so forth. And I know how busy you are, believe me. And I hope you're also busy getting out the posting to fill your old job. And maybe, Mr. Mayor, in the budget, still another position. But you might forget that we're not up to speed on a lot of these things, including the Forest Drive sector study, as you were, and as the Planning Commission was, because you did do that iteratively with them, and we were sitting here gawking, or whatever we were doing, but we weren't part of that process. So I really want to urge that if we can bring people along together and have these meetings and have these brainstorms and throw out wild, crazy ideas that may never make it into the comp plan or into the Forest Drive sector study, I think in the end it's going to come together a lot better. I am fearful. Eileen Fogarty told me that, where was it? She was in California?
Santa Cruz.
Yeah.
Was one place.
Yeah. 25 years without a comp plan. They could never agree for 25 years. Now, I don't know, maybe they didn't miss it, but to me, I don't want to do that. I'd like us to get a comp plan we can all agree to and get in place and live. Like I say, have those principles right here at these desks so that we can keep checking. Oh, yeah, that's consistent with number 5. I hope we have more than 3 principles this time, but maybe not more than 7. But anyway, so that's my spiel again.
I think one comment on that was, there was this misnomer about the high density. There was low, medium, and wavy, you know what I mean? So I guess that's a lessons learned on how did that optic get out there? And I mean, once that got out there, boom, all bets were off. There's going to be these, high density apartment, whatever, So
Right.
I guess that's the lessons learned is
Right. I was trying to use the community character types from the comprehensive plan
yeah.
to be consistent, but from the 2009 plan, but I probably should have just started over from scratch like I'm doing now, because I think that wasn't communicated very well. I think when we show an image of a 8-story building, people think that that's what's going to go there the next day, when in reality, I know that there's not going to be an 8-story building
Right.
on Forest Drive in the
Right.
next ever,
Right.
because there's so many other regulations that would prevent that.
I saw it as a
But-
multiple choice, and then you gave the scenario for each one. But I know that there's a lot of progress with this task force, and ultimately it was the best thing to happen.
And I was probably rushed a little bit on the sector study, trying to get it to council to then work on the amendments. But I feel like I have more of a luxury of time with the comp plan. I'm just trying to pace myself. In the state, you're supposed to do it every 10 years, but the state has given us until 2022 because of the census release of information. So I'm going to try to do it before 2022, but I'd like to do it 2020 just because it's a nice even number. But realistically, it can be pushed into 2021 if need be.
Have you heard from Murray Hill representatives, Murray Hill Association? I'm going to try to reach out to them. I don't think
they came to my community association meeting that I had. We had wore a representation, but not Murray Hill specifically.
Yeah, because that's a big group.
Yeah.
Okay.
Well, Fred's here just in time to adjourn.
Well, somebody has to make the motion. Alderman Payon, did you have any
Anything?
questions on comp plan, where we are?
I have plenty, but none that I'm going to ask today.
Okay.
Talk about affordable housing. That is the email I got, by the way, 2 emails today saying they were worried that there was not enough discussion about affordable housing, public housing, and given the meeting that we just had, Alderman Gay and I, with the community about gunshots, I think that those are the things that are real to the citizens day in and day out. And I know that there are expectations that there's going to be follow-up from the meeting, the listening session. And I think there were some things that Melissa said that are getting pushback too about the difference between gun violence, gunshots, and gun use, and where they all fall in the city and so on. But again, I think those things are more real day in and day out to people than the community character type. They only react to that after the fact.
I mean, if you look at how much people are spending on their rent every month, it's a huge issue in the city. We're working with housing in a few different fronts. We're working with a regional group that's looking at assessing housing needs. I'm also working with people who provide recovery, housing, and other transitional care and kind of what their needs are in the city. Then I'm also in the process of getting meetings set up with the resident advisory boards for HACA to talk to them about the specific public housing issues. So, but if you have any ideas, I'd love to hear them. I am also going to communities like Tyler Heights to get feedback from them on some of the issues that the parents of kids at that school face in a whole bunch of different factors. But housing is one of the main issues that we're looking at.
Yeah, so do you think that we'll get to a point with the assistance of the comp plan where there's affordable housing in the city's future?
That will be, that will have to be a long-term process because we're so, we're missing so much middle housing in terms of middle income workforce housing right now. And
how does that go into your role as Director of Planning and Zoning then, and helping assist in that so that when new development or construction is created, it's all not like we see up and down West and Maine, where it's just these $1 million homes or 757. Oh, I'm sorry. Apartments, not even houses. Like, how does that go? How can you, as now the Director of Planning and Zoning, assist us in helping that come to fruition for the residents in our city?
we'll be identifying goals and strategies that the staff and council can implement in order to help move that needle a little bit. I mean, you've already started on that by getting rid of the fee in lieu option. You know, we're automatically going to be seeing more moderately priced dwelling units available on the market.
I met this morning at 7:30 with Shanika and Senator Elfreth. They are very interested in us getting a affordable housing task force together. I want us to work on a roadmap.
I've already have legislation in for an affordable housing. That is not something that the state has recommended that we do. That is something that we as a council felt was necessary to do, and that legislation is already in the works. It'll actually be out by the 24th, which is Monday.
What do you mean by
council meeting.
affordable housing?
It's a task force with the goal of basically what I was hoping that planning and zoning would do, but you guys don't have the time. But just to put in the research necessary to say these are policies or actions that we may need to take to create affordable housing.
But for affordable housing, what qualifies as affordable housing?
Something that's not $757,000 where you got to work 18 jobs to afford that.
Okay.
Is that?
But not subsidized.
It could be subsidized. It could. I think there has to be a balance between the two. And I think now, I mean, that's even the amount of subsidized housing that we have in the city has obviously gone up, but that's just because of our use of the public-private partnerships now. But just to even look outside of subsidized, like how can we just bring in, complexes or, units that are just affordable, that people can actually say, okay, I can afford, 18 or 17 a month, and not break my neck and have to worry about the other bills and all of that stuff. It's just a place to live, I guess.
Mm-hmm. Right, we're working on that too. So I'd love to participate with the task force if
I got you on there as a member,
okay,
or
great.
Whoever you'd like to appoint from your office.
Okay, perfect.
Mike Laws?
And our office stands ready to assist. We have some experience with affordable housing, and a lot of the issues that are faced around the country is most people can't define affordable housing, one. Two, when they do define it, the citizens don't like it. And three, sometimes affordable housing requires us to go into a budget that will not support the kinds of things that would create what is meant in most affordable housing contexts is someone that can afford, that lives between 75% of affordable, the index for the families living in the particular jurisdiction. So a lot of different things that we have to think about. It's not as easy as saying we can build it and they will come, because even with subsidies, low-income housing tax credits, new market tax credits, it still takes people who develop properties to want to come and build in your neighborhood or in your town or in your city. So that's been one of the things that a lot of jurisdictions have to figure out, what the right incentive packages are, what you can afford, and where those properties might go.
And I completely agree with that. I just don't even think we've done the research to even say this is what we think affordable housing is. And if we have, I'm ignorant to it.
We'd be happy to help.
So I think another problem we have is we think of it as housing as just this bucket here. At the workforce housing thing that Action Annapolis did, the last woman, the mother of four, spoke. Yes, her rent was a big problem, but her ability to get from point A to point B. So you can make housing more affordable by also easing the burdens elsewhere, like transportation, being able to get to grocery stores, all of those sorts of things. So maybe we do need to, and I think this is a comp plan issue, think about it more globally than just this house is marked down from 750 to 520, which is probably also unaffordable. But I think there's the holistic thing that we have to think about.
Be an interesting chapter.
Alderman Tierney?
Yeah, that brings up, and I know Sally and I sort of passed emails on this subject. With the sprinkler bill, hopefully if it's passed, the upper floors of Main Street would meet life safety criteria to have residential use. And my dream would be affordable housing, whether it's 2 units or not, and explore opportunities to get affordable housing there. For example, waive their, waive something, sewer, water. I mean, has that been done elsewhere?
That's what we were talking about, what incentives we would need in order to attract that kind of uses. And yes, it might be some kind of waiver of connection charges. It might be assistance with settlement costs. It might be help with your security deposit or some kind of tax credit. But council would have to weigh the policy and, financially how we can incentivize it.
Yeah. So how does that, can that get in the comp plan? Well, I mean, is that a pipe dream? I mean, is that something that you
I
support?
think it's all about, as Alex just said, it's all about the incentives.
Okay.
Yep.
Okay, we'll keep talking about that. Great. Thanks.
And I think most cities in the country are grappling with this. How do we keep our young people here? We've got a good example on the workforce housing that we're doing off of Gibraltar. And I mean, there was a lot of pushback on that one. And there were some things that were said in this hall that you couldn't believe people were saying. So.
And speaking of Gibraltar, I'm looking for my traffic signal, but we'll talk about that later.
But when we have large, these massive pieces of land like the Spa Road or like the Waterworks Park, which are great ideas. It's good to play. It really is. I like to ride bikes, but it's also a priority for people to live. And when you have mass pieces of land like that, and you're able to work with the colleagues around to create these incentives, I think that we should be looking at those opportunities because, if this continues, I think in 5 years, where would I live? I wouldn't be able to serve on this body because I wouldn't be able to afford to live here. That'd be nice too, but we haven't got to that point yet. So, I think that we should be looking to use places like that. Figure out a way. If you got to split it up, recreation and housing, I think that's good. But to, just completely give away land so that people could ride bikes.
No one's saying that. We have an opportunity site there, and we have a council that can decide on what that opportunity is, right? Yeah, thank you. But when we do it, you can ride a bike through it. Anybody else? Okay, thank you so much for the update.
Thank you very much.
Mr. City Attorney, next item on the agenda.
The agenda has been completed, Mr. Mayor.
Anything else for good order?
I move that we adjourn.
Meeting adjourned.